So glad I had the opportunity to meet Tony, to be a part of Tony the Movie, and I hope that Tony the Movie helps open people's eyes to what is possible with homelessness and what the real face of homelessness looks like.
And what are you doing here in San Diego?
I'm in San Diego for other business, but I decided to be part of a panel discussion today on how San Diego is currently tackling homelessness and whether there's lessons that can be learned from the city of Houston. At least an 80% to be effective, otherwise you're still contributing to it.
At the Regional Task Force on the Homeless, along with Supervisor Roberts, our chair, as well as new leadership, we have really had, 2017 was a transformational year. We've been able to make sure that everybody is at the right table, at the same table, at the right table, that we are employing housing first strategies. So we thought right now that it was about a really good time to bring other regional leaders into the conversation. So I want to welcome and thank former Mayor Annise Parker for joining us as well. She serves now as the president and CEO of the LGBTQ Victory Fund and Institute, and we had a wonderful brunch in Mission Bay yesterday, but because of her presence here in the San Diego community, I was really grateful that she extended it an additional day to talk to you all a little bit about some of the strategies and changes that she took on, that she instituted in the city of Houston, and we see that now nationally as one of the models to look at in terms of being able to effectively reduce chronic homelessness. She was, for 6 years, a Houston City Council member, 6 years as their city controller, and 6 years as the mayor of the city from 2010 through 2016. Mayor Parker, welcome to San Diego, and I know that you still are involved in the space of homelessness, so we're really looking forward to hearing some of your inspiration and thoughts.
Thank you, Councilmember Ward. I will say that you promised me warm weather, and you didn't deliver, but I'm happy to be here, and it was a good idea to take advantage of the fact that I'm here. So while I won't say that I'm an expert on homelessness, I was cheap because I was in the neighborhood, and that's a key issue that we're going to need to be talking about, is that how to leverage money that's already being spent. In Houston, when I came in as mayor, we had a homeless population of about 10,000. With approximately 2,500 who were chronically homeless. And we were spending about $100 million a year, primarily in emergency room care. We were able to calculate the direct cost of emergency room care, add in the shelter costs, law enforcement costs, not able to calculate things like lost opportunity cost, impact on property values, and so forth. But when you quickly, with hard dollars, get up to a number like $100 million, even in a city as large as Houston, you're able to get everyone's attention. So one of the things that we discovered as we decided to turn to homelessness is that there are a lot of myths about it. And I'm going to start with some of the myths. One is that you can end homelessness, and you cannot end homelessness. You can manage it. It's like a chronic disease. And there are new people who are falling into homelessness on a regular and routine basis. You still need the mechanisms of dealing with homelessness. You need the shelters. You need the temporary services. But the real, and there are different services that need to be directed toward those who are able to function in society, have been functioning in society, and then suddenly have fallen off that path for some reason, but with a little help can get back on it. And then you have a significant population that is always going to need a certain level of supportive care, wraparound social services, ongoing. And that's that chronic homelessness number that I was talking about of 2,500. So, again, the first myth is that, well, we're going to figure out the solution to homelessness and we're going to end homelessness. We can manage it, but I'm going to tell you that I do not believe that you can ever end it. What you can do is create a steady state system so that as people fall into homelessness, you can help direct them to the appropriate services and move them into a pipeline away from street homelessness. There's another myth that if you begin to build facilities for the homeless, if you build it, they will come. And I cannot tell you how many times I have heard, well, why do we want to build new facilities for homelessness if we start advertising that we're doing all these amazing things for our homeless population, people from all across the country will come and they'll try to take advantage of it. You're talking about a population with significant mental health and substance abuse issues. Doesn't mean they're stupid, doesn't mean that they can't take advantage of opportunities, but this is not a population that says, oh, where are the best places in America for the homeless population to live? I'm going to go there. They live in cities for the same reason that anyone else lives in cities. They come to cities because they have families, because they used to have a job, they have some connection, or they drift there. But doing the right thing for homelessness does not mean that you're suddenly going to have an influx of new homeless individuals. And frankly, as we begin to do the right thing for homelessness across the country, hopefully that myth will be put to rest, because there are opportunities in more places. Another myth is that the homeless have no assets, and I'm going to talk about that in just a bit. Particularly if you're talking about veterans homelessness, many of them, if they've served honorably and were discharged, they have veterans benefits. If many of our homeless we discovered had Social Security or disability benefits, but they weren't accessing them because they didn't have a place for those benefits to reach them. And then the final myth I want to talk about is that building housing for the homeless, particularly SROs or single room occupancy facilities, drags down property values. I would encourage you to visit some of the top SROs in the country, and we have a few of them. Our primary builder and manager of SROs in Houston that we've worked with as the city was a group called New Hope Housing. I would be proud to live in one of those facilities. I'd be proud to put my mother in one of those facilities. These are amenities because of the quality and the care that we put in on the front end. Just because you are homeless, just because you're going to need help, doesn't mean that the facilities in which you live should be substandard in any way. They don't have to be elegant, but they have to be functional, and they can be aesthetically pleasing and an amenity to the neighborhood. We have 2-year terms in Texas. We don't like politicians, so we make them run a lot. So we had 2-year terms. So when I started my second term as mayor, in my inaugural speech, I announced that we were going to tackle homelessness. And I had a secret weapon, and that is that the federal government, under the Obama administration, had announced a special initiative to try to take homeless veterans off the street. And so the tool that I had, the most important tool, was I had new money and access to new money. And we have one of the largest veterans populations in America in the greater Houston area, which also means that we had one of the largest homeless veterans populations. But we had a caring, supportive community that if you go to them and say, we're going to do something for the homeless, they'd say, let's move them somewhere else. But if you go to them and say, we have homeless veterans on the street, no one who has served this country honorably should be on the street, there's a different mindset. So it allowed us to have a new conversation. And we started with, I'm a believer that the more shared facts you have, a good data to start with, you get to a better solution. We do a homeless count, as many cities do, every year, but we don't have homeless conversations. So what we did over about a week-long period is we went out and we tried to interview every homeless person we could find in the city of Houston, both transient homeless and chronically homeless, with the focus on the chronically homeless. And I will say the phrase, the homeless, but that's the wrong way to say it, and I'll apologize for that, because it's not the homeless. They're men and women, they're human beings. It's John and Jack and Fred, and they have different unique issues and circumstances. And the first problem we realized was, as long as we thought of them as the homeless, we were trying to create solutions for the group, and we had to create solutions for the individuals. 85% of our homeless population was male. half of them had substance abuse and/or mental health issues, often overlapping. But again, by having individual conversations where we got their name, we got their information, in-depth conversations, and that's where we found out that many of them had assets that we weren't tapping. Houston happens to have a large veterans hospital, but our veterans hospital had never been engaged in the housing piece. It was, you come in, you get your health care, and we turn you loose again. I don't understand where they thought they were going, but veterans hospitals have, as part of their mandate, to work on these sort of chronic conditions, and that was another element of what we discovered. We also have in Houston the Coalition for the Homeless. So all of our agencies that are in that space, whether providing temporary shelters, the Housing Authority of the city, the Housing Authority of the county, come together and meet on a monthly basis. They have an executive director, keeps track of what everything was doing. What I discovered is that, as I already knew, we had amazing, wonderful organizations. That $100 million doesn't count how much was being spent by the nonprofit NGOs in this space. But we had a great number of organizations that were operating in parallel to each other, not ever converging to solve a problem, but managing their own individual case flow as it came through their agency based on the missions that they had. Next step I did was I hired a person onto my staff, borrowed from the Coalition for Supportive Housing, and made one point person in the mayor's office reporting to me, so that I hate to say it this way, but one throat to choke. One person I could turn to and say, what's going on now? And I wouldn't have three people pointing at each other. And then we began to convene meetings. We asked for a meeting, again, going back, new money. That always brings people into the room. And we're going to deal with veterans. That brought everybody into the room. And we had the opportunity to say, we have a new mission. We're all going to work together. We can't let our veterans down. What are your assets? Put them on the table. And we all did. And because this was a new mission and it wasn't a threat to anybody, what they were doing, we were able to say which, I need so many beds that have mental health services. I need so many beds that might be detox beds. I have so many, we have women, this is what the population is for men. And we had a defined population. We knew what percentage we had were homeless. I said, the challenge from the White House was, could you house 100 homeless veterans, chronically homeless veterans, in 100 days? And we did it, barely. We housed 101 in 100 days. And so then we said, that was fun. Let's do it again. You can't go away, let's do it again. We did another 100. And by the time we had done the third 100, we had a new mindset. We had new ways of thinking about how the services could be applied. And we knew which agencies were more nimble than others and could respond effectively to the new challenge. Then we began to take the lessons that we learned from dealing with the veterans with no new money, with the old money and the old organizations, and said, what have we learned? First thing we learned was that we were, every agency had their own tracking system. So we had to have one database shared by all the regional agencies that they could load information into. That each agency had a different way of categorizing the men and women who were coming in for their services. We had to have a shared system of how to evaluate these men and women. And if we were going to make the permanent change, we had to have someone then to wield the big stick, and that was my responsibility. And then finally, there had to be a feedback loop beyond the social service agencies that were in this space. So I created a business advisory council. For an example, the Catholic Diocese, the largest philanthropic organization in Houston, a number of business organizations, not people who were directly providing services, but people who were deeply interested in the issue, with a bi-monthly reporting opportunity where we sat down and I and my homelessness advocate came in and said, this is what we're doing, these are the agencies that have stepped up, and just so that the business community was aware and bought in, and they could advise if they thought we were getting off track. Mentioned the big stick. The big stick was, as we looked at, we had great organizations doing wonderful work, but often we discovered that they weren't doing the work that we needed. We had empty beds night after night after night because a particular agency, well-funded agency, was looking for a certain demographic to fill those beds. I had to be the one to say, I will move your money. You either give me the kind of beds I need for the people who we need to serve, or I need to move that money into other places. And so I don't know how the system is here, but there has to be some entity that can look for the most efficient services and move the money, not just keep doing it the way we've been doing it, but look at the ways to move the money into the services that are needed. And really evaluate those services. At first, we were really excited about placement rates. And then I realized how important retention was. And you cannot create a system that looks at placement if you don't also create a system that looks at retention. And then as some agencies have a higher recidivism rate than others, again, constant feedback, looking for an opportunity to keep people permanently in housing. Sorry, you mentioned that the importance of vouchers. Both the city and the county housing authority stepped up. We had thousands. We close our housing list at 50,000. The city of Houston proper is about 2.2 million people. We close our housing list at 50,000, so it's always capped. And I had a lot of people on the housing list, but we stripped every housing voucher from both the city and the county housing authority and put them into the homelessness pool because we believed that we had a more critical issue to deal with. Again, those are not easy decisions, but to me and to the leadership council I put together, those are appropriate decisions. So looking for ways to recalibrate and rethink what we're doing is important. We were able to drop the overall homelessness rate by 60% in a 3-year period. We were the first big city in America to effectively end veterans' homelessness. It doesn't mean that there's not a homeless veteran on the city of Houston's streets today. It means that if we can identify a veteran within a matter of hours, I can place that veteran in a housing facility. But I'll close, and I'm looking forward more to a dialogue than a speech. But what we all have to remember, and this is America, people have if they choose to live under a bridge, that is their right. We have the opportunity to create a system of laws and rules and ask them to abide by them, but we cannot force people off the streets, and we cannot force people into our facilities. One other thing I want to mention, because I think it's important, is we were looking at the overall process. The city of Houston has a jail. We were the last big city in Texas to have a jail. We also had a county jail, and I was trying to get out of the jail business, and the county said I had to reduce the head count before they'd take my prisoners. And I looked at the head count. We were between 17,000 and 19,000 people a year arrested in the city of Houston for public intoxication or substance abuse in some public venue. And we created, it could be part of this conversation or a separate conversation, we created a sobering center based on the idea that we really needed to decriminalize public intoxication. We have the Houston Center for Sobriety in Houston, which now if a city or county law enforcement officer picks up someone who is publicly under the influence, rather than taking them to jail, if there's no other outstanding warrants, they take them to the sobering center. You stay a mandated 4 hours or until you are completely sober and a social worker or medical person says that you are capable of leaving, and then you just check out. You don't have a criminal record. You are free to go. We discovered, we did that for a year, just letting him go. We created a database of knowledge. Now we are tracking those who recycle through the system and creating a tiered level of intervention. And we have a handful of people who are there once or twice a week, and we're now creating a mechanism to put them, giving them special attention moving forward. But on a lighter note, I actually got a thank you phone call from a businessman from Florida who did not have to go back and tell his wife that he was in jail in Houston because he'd spent the night in the sobering center. It's really based on the old Andy Griffith show where Otis, the town drunk, would let himself into the jail when he got inebriated and then let himself out. This is an alternative to incarceration. The best part, takes a police officer 15 minutes to drop somebody off at the jail instead of an average of 45 minutes at the sobering center, then as an average of 45 minutes at the jail, and it costs 1/3 as much. Better all around, plus saving tax dollars. Let me pause and thank you for the opportunity to talk about that.
Well, thank you. A lot of what you're describing is what we've been really working on this past year and following your model. And it's good to have you. We probably should have had you here a year ago. The one part that I think we've been successful, we have had a detox center for specific time, and we get a lot of people in jail for a lot of other reasons, but that one we've tried to head off. But I want to next introduce Gordon Walker and share with you some of Gordon's background. A year ago, it was clear when Councilmember Ward and I became involved with the homeless task force that we were going to have to make some changes, some significant changes. The model was almost as the mayor described in terms of what was happening or not happening. All with a public spirit and all working parallel to one another. The cooperation across lines wasn't there. Things such as a coordinated entry system, system of homeless information wasn't there. Almost everything you described would have been the status of San Diego a year ago, with very, very few exceptions. So it became clear we needed somebody with some experience. We had a lot of people that were interested in the position to come in and be executive director of the regional task force. Virtually all of them were well-meaning but without experience. And we wanted somebody with experience. And Councilmember Ward and I went through a very long list. I think there were maybe 70 or 80 names on the list. We culled that down, and then we went through a number of interviews. It seemed like I was in interviews for about 2 weeks with people. I was delighted when we found somebody that not only had experience, but incredible experience. And while he was from out of town, in fact, by way of Germany, he had been from Salt Lake City, where he had a real reputation. I think actually had some involvement in Houston at one time. But had a real success story, just as the mayor described the reductions in Houston. Salt Lake had a similar significant reduction. And their chronic homelessness, what we realized they had like a 90% reduction in chronic homelessness in Salt Lake. And after a number of interviews, I was delighted that Gordon Walker, who is really a nationally recognized, experienced professional working on homeless issues, accepted our invitation to come to San Diego. Fact of the matter, he had a daughter here, so we had a little bit of leverage with him, and we were delighted then, and I remain delighted because he has internalized and helped us to lead us down the path of many of the things the mayor has suggested. And Gordon, why don't, instead of me continuing to brag about you, why don't you share with us some of your thoughts, please?
Thank you. Thank you very much for that. Mayor, I've looked forward to meeting you for several years. As one of your individuals, Neil Rakow, brought the entire team up from Houston to Salt Lake City, and we toured around for 2 or 3 days, and then he came back a second time. He indicated that very strongly how committed you were to making change. And so it's been kind of fun to see this happen and to vicariously share some of the experiences. It is interesting as we talk about these things how many overlaps there are in what makes this work and what does make the system work. We started, didn't know what we were doing. My team will deny that, but we did want to make a change. But what we found is that there were really 2 or 3 key principles. Number one is it takes political will. And so to see mayors and council members here today, that is terrific, because without your involvement, it doesn't happen. It truly doesn't happen, and the mayor's comments really make that very clear. The second principle is collaboration. And one of the problems, if we see everybody swimming against one another in the stream, we will not see forward movement. Sometimes it takes another issue to break that logjam to move forward. And treating them like individuals. I've always used the word compassion. It's always interesting to me when a discussion of the homeless population begins. If someone talks about those people, you know that they really don't understand the issue. Because as people ask me, there are many locked gates here in San Diego area. And when people behind me, locked gates, ask me the question, well, how can I help? And it's an honest question. I say, well, why don't you go down and say hello to a homeless individual? I used to say shake hands or give a hug, but hepatitis helped cure us of that particular issue. We may be coming back into that area, but the fact of the matter is, until we know, I forget the Mayberry character that
Otis.
Otis. Until we know Otis and Otis's friends and family, we will probably not be successful. But when we do get to know our own Otises, because they are our friends and family, and the second that we begin to recognize that, we will tend to be much more successful. So Mayor, I'd love to just say, great job. I'll say that, great job. But the message I'd like to leave today with the group that is here is that San Diego is not different. When I came, I was questioned, well, why did you come? Why did they bring you here? San Diego is different than Salt Lake City. Well, is it different from Houston? And the answer is not really. If we think that we are different, if we think that we are special, we will never make that change. Mayor Parker has indicated that they had about 2,500 chronically homeless individuals. Salt Lake had 1,934. You'd think I'd forget that number, but I don't think I ever will be able to. Well, last year here in San Diego we had 2,176. So that's somewhere between 2 entities that have had some real success. So we're not really special, but rather we're average. We're normal. We have a big problem. It will take some time. I don't think, Mayor, that you did yours in 6 months, like Ron Roberts was trying to pin me down when he was interviewing me. He says, how soon will we be able to see a change? And I said, oh, we'll see a change in a year. And he looked at me, and I knew that was the wrong answer. So I said, we'll see a change in 6 months. We've seen some changes. Not the changes that everybody wants to see, but in the last 8 months, let me just share 3 or 4 things that we have seen and that we're working on and we're trying to put together, that when we come together and mesh all of these items together, you will see a system of processes that will last beyond. Now, Mayor Parker, in her myths column, said we can't end homelessness. I agree with that. I used to tell the governor of Utah, if you want to end homelessness, get rid of this good economy. Create no more jobs. And that's a problem here. We have a great economy in San Diego, so there will always be people that are coming toward a good economy. But we can do something with special populations. One population you've mentioned is the veterans. There's been a lot of work done on that here, and we're actually trying to zero in on how we can zero it out. We're actually seeing some signs that that may be that the problem may be decreasing. I have always focused on the chronic because the chronic use most of the resources. 10% of the people who are homeless nationally use 50% of the resources. So I sometimes use business terms and the press criticized me on me, so I won't talk about paying down your credit card, but the fact of the matter is if you house your chronically homeless, then you have more resources for the other populations. We do not want to leave families and children out. Certainly those are all important, but what we have to do in order to be effective is we have to focus our resources and deal with these issues on a one person at a time. And this is the important part of dealing with these individuals as individuals, because their needs are different. I must admit, Supervisor Roberts, that after having been here 7 or 8 months, that I actually have quite a bit of hope. Not everybody had hope when I came. I reserve judgment, but I do have hope because we are putting together, we are actually tearing apart some of our systems that we have found that weren't quite as strong as they needed to be. For example, our homeless management information system, which, by the way, we do a count every year. Maybe some of you participated in that count. I'm going to give Supervisor a chance to raise his hand. How many participated in the count this year? Well, good. A lot of hands went up. That's great. That information is currently being processed. And we will then prepare a report that we will get to each of you as mayors, as city council members, as your city managers, so that you know exactly what's happening in your area, so that we can tailor the issue differently. For example, Encinitas is not San Diego. As she says, praise the Lord. But on the other hand, Encinitas has a problem. It may not be as demanding, but we want to make sure that we work with you using best practices and using the best processes that are available, many of which Mayor Parker has outlined. And we will continue to outline these for you and with you. We will be working, hopefully, if you'll let us through the door, we'll come and work with you. One thing, when I come, I'm not just asking for money. I've had some mayors, I can say this because they're not here today, that when I walk through the door, they're asking me for money, that I'm asking for money, and I'm not. I may have been 8 months ago, but I'm not today. We all have limited resources. Understand that. I understand that. But we all have some resources. And what we have to do is to develop a plan. And we have coalesced, as has the federal government, around the plan of Housing First. And Housing First is a model that instead of asking people to change their lives while they are without a roof, an address, a door, that we house them. And as we house them, then we're able to provide wraparound services so that they can change themselves. And Mayor Parker's talked about a couple of good services that we'll take a look at. The Sobering Center is a great idea, because if you get into the studies on incarceration, incarceration is very expensive. Let me just mention one anecdote out of one study that was done. There was a study of the 39 individuals in Salt Lake that had been jailed consistently. And one fellow stuck out. And of the first original 39, the second year there were 33 still on that list. 3 people had died, happens on a regular basis and at a much earlier age if you're not housed. One person had been in jail 179 nights, primarily for soberification, whatever is happening. But the next year, his numbers dropped to 0. And in between those two, the only change in his life was he was housed. So he went from 179 nights in 1 year. He was housed. There was no relationship. He just came up the list. He was housed. The next year, he was not in the jail system at all. I mean, it's just, yes, that's an anecdote, but there's a lot more anecdotes right behind that. And if you get enough anecdote, it actually creates a history. So I'm very positive about what we're doing here. And we want to work with you. We're out trying to meet with your city managers, with your council members. We'll meet with anybody to do this. The city folks think we are a captive entity of the county. The county folks think we are a captive entity of the city. We are neither. That's the advantage of having done this once before. I know not to become captive of anybody, but I hope that I'm properly respectful of all. We are working together as the regional task force to make this a regional solution. I hope that you've been following the press lately, because there are 4 big cities in the country, and we're number 4. This is, where the governors get up and say, we're number 1. We used to kid with all the politicians getting up and saying, we're number 1. I actually have a foam finger in my office. I haven't brought it out yet, but I have it available. If you start doing that, just remember what's going through my mind. This is not a list you want to be on, because this is the number of people that are homeless in the country. Number 1 is Los Angeles. Number 2 is New York City. Number 3 is Seattle. Number 4 is San Diego. You don't even make the list anymore. You should be ashamed of yourself. It's a list that we all want to avoid. More importantly, and when I came, I was openly fearful that San Diego was going to lose its streets, give up its streets, as has San Francisco, to homelessness, to encampments. The LA Times has been running a series of articles that are just, they're mind-boggling. And we have to decide what we want to be. And what we want to be is a city where people worry about whether it's warm or not. My wife had 15 inches of snow yesterday, so this is still good. And that's where we're really going. The number that I've been looking, there's 2 numbers I've been looking at. Number 1 is the number of chronic homeless individuals here in this area. Last year was 2176. That is a number that was self-described. And so it is somewhat suspect. We're waiting to see how it comes out this year, and our outreach will prove out how our numbers are. If we start every year and move that number a little bit, we will be able to deal with this population. This is the population that is primarily on the streets. This is where your mental health patrons are. This is where heavily drug, alcoholic patrons are. And if we take care of that, that number of people will at least reduce the number. No, we will not end homelessness. No one has the resources for that. We don't. But a high percentage of the homeless becomes economic homeless. We'll leave that to you folks as politicians to deal with that issue. That is something that we, as service providers and helpers within the system, do not control, nor will we try to control that. But if we deal with those who actually need it, and that's where our focus is, in identifying people who want to swim in the stream. The stream now consists of Housing First, all federal funding. The federal government changed how money is allocated to the systems, primarily because of the success of Utah, the success of Houston, and the success of a few others. Because in every case where any success has occurred, it's been because of using Housing First model. And so that's a model that is proven to be scalable. There are many models out there that are very good, but they're good for 5 people, 20 people, 100 people, 200 people. They're not good for thousands of people. So we scale this. It's the most efficient use of resources, and it makes it so that we can actually see success. Now, Mayor Parker's done an excellent job of telling us about the myths. Let me just say, we're in agreement. What you said, it's just like, it used to bother me when people stole my stump speech. Well, good job, Mayor. It works, and I really see, I'm very positive about what can happen here in San Diego. There's a lot of action, and that movement is beginning to align. And as that aligns, and the funding aligns, we will see some very significant changes. But it does take longer than 6 months. So I'm open to talk at any time about it. If anyone wants to talk, give me a call, because we'll come meet with you and with your council and with anyone in your community. So thank you, and thank you for allowing me to come today.
Open this to questions.
Actually, hi, Ginger Marshall, City of Solana Beach. You mentioned the veterans population of homeless. And I don't know if San Diego or Houston, what percentage are children that are aging out of the foster system? I have a little bit of experience just working on the charitable side of that. And I know that they have some homes available, especially to girls, but they won't take them unless they're completely off drugs. And then that brings up another point that I wanted to make this morning. I read in the paper that San Diego has $185 million earmarked for mental health issues, and just how is that? Sounds like that was in the San Diego Union this morning, and it sounds like that money is not being utilized as efficiently as it should be.
Well, first of all, the headline was about counties statewide, and if you read down a little further, it said no, San Diego County is complying. One of the biggest problems we have right now is that, you should be aware of it, we are being held up because of a court case and being able to use those dollars for housing. So we can use it for services and we can use it for other things. We cannot use them for housing, and that's one of the areas we'd like, but pending the outcome of the court case, we'll see. This was a result of a state ballot proposition a couple years ago that's created this, So this is in effect new, but our, probably the biggest problem we have right now is hiring the professionals that you need to handle these programs. When you go out and you try to hire for our homeless outreach teams, our psych teams, PERT teams, all of these, when you got to have trained psychological professionals, I got to tell you, the money's coming in faster than the capacity to be able to handle it. But if you read the article thoroughly, you'll see that the County of San Diego got pretty good marks in it.
And just back to my previous question, what is the percentage of people on the street that are foster kids aging out of the system? Do you have?
I don't know if we know the percentage.
I mean, just a ballpark.
Actually, this is an elusive number, and in fact, with this year's, it is. There are many people who will say it's not elusive, but it is elusive, and it's because teens oftentimes will couch surf, and so you don't have a good feel for it. We did a special, as part of our point in time count this year, we did a special week-long count in order to try and get a better feel for that. We're working with several service providers to get a grant, an additional grant for that group of people, for the youth. It is a population that there's a great deal of concern about because oftentimes they're pulled into areas that are not nice for them. And so we're focused, we've got one eye looking out for them to see what we can do and trying to support the entities that are using the Housing First model, because that's all that we can do with federal dollars, but also trying to help them. There are some very good programs around, but again, as you talk about, they may have 2 houses with 8 kids or 15. I mean, they're small programs. They're not necessarily scalable to any great deal of amount. We just have to be careful and keep them in the radar.
So, sir, may I answer this?
Please.
Short answer is we have no idea how many are underage. The positive is that for underage homeless, you have interventions that you can do that you can't use on adult homeless. They're either supposed to be in school or under someone's guardianship, and so you can.
These are the kids that are 18 there.
So I was going to say, but aging out of foster care, they just fall into the adult population, and we don't have any good statistics on them at all.
But I should share with you, and I suspect that this may be true of Houston also, because it's national, but in San Diego in particular, our kids in the foster care system is way under half of what it was 5 years ago. The number has been reduced. One of the problems we have capacity in the system for the foster kids themselves. We don't have the numbers to deal with anymore. I mean, one of the things I'm proudest of is something we started called the San Pasqual Academy. And we're way under capacity in that system because the numbers overall have dropped dramatically. And I know this has happened in some other areas, but we've been very aggressive on adoptions and other programs to family reunification. I could go on and on. This is an area where seeing the numbers drop, I gotta think that the number of kids aging out of the system has dropped because there's fewer kids in the system.
Not in Texas.
No?
No.
Oh, oops. I was going to give you credit. Okay. I'll go to Texas and we can talk about the homeless.
I have 3 children that I adopted from foster care. I'm very familiar with the Texas system.
Ron, if I could add on too before you get to Mayor Blakespear, I know that the point in time count between 2016 and 2017 saw one of the largest increases in the transitional age youth population. We saw almost a doubling of those, and we have very few, I think, institutions. One of the premier ones in the county is San Diego Youth Services, but very few that actually work on that subpopulation. The good news is that because of Todd Gloria and some other efforts out of the state, we actually are seeing I think a 5-fold increase in the amount of state funding that can go towards youth homelessness, and they've expanded the youth definition to 25 for those that have aged out of the foster care system. But as we heard earlier, it's often hard to count them too. So while technically the count did show a doubling of unsheltered TAY population, we're not really sure whether we counted accurately in 2016.
I think it's just sad because a lot of those kids that slip, young adults that slip through the cracks end up in prostitution and drugs. And
real fast.
Yeah.
I actually know that New Directions in Oceanside works specifically with the foster kids because it's that are aging out, because there's this worry of the human trafficking aspect of it. And so I know that the age is 25, and there's a lot of resources out there to find housing for them. And we have a lot of affordable housing in San Marcos, and I've actually started talking to the developers as they're bringing homes online to say, okay, can you specifically work for, you know, how to find these foster kids that are aging out, and how do you provide housing for them? So I know they have been in contact with the county to work specifically on that. So I think it's something that we can work on as electeds of, you know, talking to the affordable housing developers if you have affordable housing in your city, but also just, you know, finding the right places like Casa de Amparo, which runs New Directions. They actually are a good resource for things like that. So I think, you know, just having more organizations and knowing who they are so that you can, you know, match up those services.
There are transitional housing opportunities. We've started a number of programs. We've worked with other providers like Wings down over near Midway Drive and others that actually take the kids in. I say, kids, these are young adults now. I teach them how to handle their finances and other things that they've never been prepared for. But it's a good question. Mayor Blakespear?
Yes, thank you. So thank you, Mayor Parker and Mr. Walker, for your comments, and I want to thank the Regional Task Force for inviting some local elected officials, because learning about best practices is really critical for us, I think, as we move forward as a region. I wanted to just ask the mayor one question. You referred at the beginning of your speech, or of your talk, to two larger groups. I know everybody has their own individual circumstance, but one is basically people who are functioning, who have some job loss or medical bill or other circumstance that might lead them into homelessness, or maybe they're in their car first and then they're homeless, and they need a little bit of help just to get back on their feet to be functioning. And then another group which struggles with mental health and substance abuse and uses 50% of the money that we allocate to this problem. And I'm wondering, when you're thinking about prioritizing which groups or which group to focus on, how do you prioritize that, or could you just give a little bit more detail about that? Because it seems to me like that first group, it will increasingly struggle with the societal trends we're seeing, like income inequality and housing affordability problems here, the high cost of medical care, the social safety net having a lot of holes in it, and I just wanted to know how, in terms of those two groups, where you think the priority maybe is best focused.
The economic homeless, or the short-term or transient homeless, where they just sort of fall in and they have the ability to come back out again, the nature of that population differs very much city to city. The chronic homeless population is much more, I won't say it's uniform, but the issues are much more similar. So it's not so contextual. And when we were dealing with veterans, we were dealing with all veterans coming into the system. But when we really decided that we were hemorrhaging money on the chronic homeless population, and that was one that we needed to prioritize. But it also is a matter of the resources of it. Texas is a low-tax, low-service state. It's not there are not a lot of resources, so we thought we'd get more bang for our buck. But you may make a completely different decision here. So I don't know what the mechanism is here.
I think in many ways the easiest way to go about it from the homeless point of view is to deal with the chronic, because the economic issues oftentimes are much greater and more driven by the economy than they are. There is another program called Rapid Rehousing that really deals with those who are economically challenged. And that is, that once we found that it's very difficult to prevent that or to predict prevention. And so we did, in Salt Lake, we did not spend any money on prevention or limited funds, but rather allow them to fall into homelessness, and our main shelter there was able to house them within, on average, 27 days. And what that housing consisted of is either finding them an apartment, finding them a house, an appropriate house, helping them with a down payment or whatever else. Now, one of the things that we're going to try and do a better job of here is use what is called diversion. So when someone falls into that second group that you're talking about, not treat them as though they were homeless, but rather treat them for what it is they really need. Because there are some short-term, very quick solutions to help them pull themselves up and move back out of the system. In fact, what we would hope to do is to never let them get in the system. They may fall toward the system, but we identify the problem sooner and make it so that they then can crawl right back out with the appropriate assistance. It's not a free system, but it's a much less expensive system.
I think the message here is, well, we've talked a lot about either mentally ill or veterans. It's not to the exclusion, and it's not in setting that as a priority that there's pretty aggressive programs that are dealing with these, other levels. And especially when you have, if there's somebody out there with a little bit of help, we can get them off the streets. And I think the operation of the 3 shelters that have been established here recently kind of typifies, because you got one that's basically family oriented, you got another that's veterans, and then you got another that's kind of everybody. So it's not to the exclusion. I think it would be wrong to say, gee, that's a priority, so that we're focused on that. It's really, our whole effort is far broader than that. Mayor Morrison.
Yes. Mayor, when you mentioned on the myths, and one of them you said that the myth of if you build it, they will come, being a myth, you said there could be drift. We've certainly seen, I think, within the San Diego region, a lot of drift. When the city of San Diego started doing a lot of homeless activity in the East Village at that time, there was a lot of drift. All of a sudden, there was a lot of homeless all into that East Village area. And I know when we do the count of what was their last residence, and before they became homeless in the area. Well, for most of them, no matter where they came from, they stayed time in a motel sometime in San Diego, so that becomes their last residence. So it looks like as if they came from San Diego. And so when the city of San Diego started pushing them out of East Village, cities like mine, which we knew all of our oldest, we knew them by name, they were all family people. Now all of a sudden we got a deluge, a drift, I guess you would want to call it, from downtown San Diego, of people that we didn't know their names and they didn't have family in our area, and has caused a huge problem. And so now we have like Caltrans, where what they've had to start doing is along our freeway entrances and exodus, they're bringing in grinders and they're grinding all the vegetation out because the homeless have caused such a problem. I'm not seeing them using any grinders in North County. And in the same way, when the shift started in downtown San Diego, the moment a few homeless showed up in North Park and Hillcrest and Balboa Park, there was big articles in the paper about protests from the neighbors. Mm-hmm. But all the shift that went east and southward, we didn't hear a word about that, and that's where the majority of the shift was. And when I go out and talk to these people, and the ones that will talk with you and can talk with you, whether if they're from Memphis or Chicago or Denver or Phoenix or everywhere all over the United States, and they're not our oldest. And so how do we keep from having a system to where we're just looking at numbers, and sometimes it's kind of artificial because we're claiming they're all, that the overwhelming majority are from San Diego when they're not. They just spent time in a motel somewhere at one time. And then we just play whack-a-mole, moving them around from community to community.
That's why it has to be a regional solution, and it requires coordination. I was really talking to the idea that a lot of folks believe that if you have a robust set of services available for both homeless populations, the economic homeless and the chronic homeless, that it's a magnet for homelessness. What you're talking about is that we use things like civility ordinances to just move the problem along, and that's a completely different issue from the idea that if you do good things, that you'll become a magnet for the homeless. We're much more prone in cities all across America to try to get them off the streets so that they're not a problem, but they have to go somewhere. And so if you don't do it in a comprehensive manner, you end up with we just keep moving them, and we create a homeless vortex. They move from location to location.
No, and I want to thank you for bringing that up too, because I had the pleasure of simultaneously representing downtown and Hillcrest and Balboa Park and Golden Hill, and we do have that narrative on the ground between all those communities about work that we're doing down here, whether or not that's displacing individuals into other communities, and it's difficult. Nobody wants to be able to take a facility or receive or help. They want, the easy thing to do is for it to go somewhere else. I remember that, you know, from our point in time count last year, one of the cities that had a statistically significant reduction was Chula Vista, and I'm sorry they're not here today, but you know, we saw, I think, a 9 or 10% reduction in the total count down there, and I think while some were quick to celebrate, we were also reminded that they also had a heavy enforcement of their sleeping ordinance, where you couldn't sleep in your car anymore. They did displace individuals up north, right, into your city and into the city of San Diego, and so that wasn't ultimately a regional solution. We needed maybe a safe parking program that could be able to help deliver these services that we're doing regionally onto Chula Vista homeless individuals. So I know some of us have homeless counts in the single digits, some of them have in the double digits, some of us have homeless in the triple digits, but we're really only going to, I think, be successful as a region if we look at this year's information and really try to tackle this regionally and proportionally, because all of these systems that we're trying to do and we are kind of underway right now are scalable, and I don't want to ever have to ask any other city or jurisdiction to have to take on, you know, any more, but I'm just asking for everybody to maybe try and do a little bit of something, a good start in 2018, because we're doing a lot here in the city of San Diego, and I know that one good start would be to actually just sign up with the Regional Task Force on the Homeless. I want to commend the city of La Mesa that took that step just a couple of months ago by resolution, I think a unanimous resolution of your council and mayor, to be a part of the Regional Task Force on the Homeless, because we can provide a lot of those best practices and that information so that when you and your staff and other elected officials are ready to go, you can employ some of those very same systems at a scalable rate in your own jurisdiction. So that's one thing we'll be sending out. I know we wanted to try to aim for an 11:30 stop time. That's one thing that we'll be following up with all of our sister cities across the region, is how can we actually get involved and what can we be able to do that makes sense for our respective jurisdictions. I'd also ask you to look forward to the month of April. Sometime mid-April we're going to have the results of this year's point in time count that are going to show some of those very same changes in the overall population, the census information, because I think one thing I've taken very personally in my first year in office is to really be the arbiter of a lot of important information. There are myths that are out in the community that trickle down to all of our shared constituents. Not everyone has a mental health issue and you can't solve that. That's not true. A lot of people do, but it's actually not most people. Everybody's on drugs. That's not true. Everybody's from somewhere else. That's also not true. And whether they had their last residence at a motel or otherwise, we know that 77% of the individuals fell into homelessness, but that means we have 23% from outside of the county of San Diego, and that is significant as well. That's why we invested more with our family reunification program, and as of just a couple weeks ago, I think over 500 individuals from downtown streets were successfully placed with a family member, followed up with. Over 90% of those were shown not to have come back into homelessness and are not coming back to San Diego. So we can work on those kinds of programs and services that are showing success on the individual subpopulations. We have new bridge structures, 700 individuals, close to 700 now, that are in 3 large tents. And this is an emergency solution. It's an expensive solution, but it's getting people off of our streets. They want to be housed. The other myth that none of them want housing, it's not true. Many of them are housing ready. They want to be scored and assessed. They want to be housed, and we will work with them and we will find them those opportunities. So I'm excited for the things that we're doing in the city of San Diego, but we're not going to be able to sustain this alone. So we are going to be able to follow up with all of you. Part of our charter with the regional task force is to form an intergovernmental council, and that's something that we want to keep as, you know, manageable for certainly all of our schedules, but we'll be following up with you on that opportunity as well to continue the collaboration and the work that we can do together as the year progresses. Ron?
Supervisor, I'm happy to share my business card with anybody. It has my cell phone number on it. Stick around. I'm happy to visit. And I do want to mention, I'm now with a nonprofit in Houston called the Patient Care Intervention Council, and we're trying to tackle homelessness from a different area, trying to catch them from the healthcare system side. And it's the 80-20 rule. 20% of patients consume 80% of resources. A significant number of those are homeless. And if anybody's in the healthcare space that I can connect to, I'd love to do some of that.